I'm here to see a client by the name of Mary Smith. Her date of birth is 4/27/1976, and per Mary's medical administration record, she has no known allergies. Mary hasn't voided in over 4 hours, and she has an order that states if client has not voided within 4 hours, use bladder scanner to check residual amount. If residual is greater than 200 milliliters, then perform intermittent urinary catheterization. I did bladder scan her, Mary, per the doctor's order, and she had 400 milliliters in her bladder. So I have to go in and explain to Mary that she needs to be straight cath, and I'm going to explain the procedure to her. First thing I'm going to do is gather my supplies. I have my clean gloves, my catheterization kit, my wipes, my hand sanitizer, and my garbage container. The first thing I'm going to do is I'm going to knock on the door. Well, I'm sorry. First, I'm going to check my expiration date on my kit. And the expiration date is August 31st, 2024, so we're good there. Then I'm going to go in and I'm going to introduce myself and explain the procedure to Mary. First thing I'm going to do is knock on the door and make sure Mary can identify herself so I can make sure I have the right client. Okay, can you give me your first and last name? Okay. And your date of birth? All right, perfect. I'm here because, as you know, you have an order to be straight capped if you have more urine in your bladder than the doctor would prefer. When I came into bladder scan you earlier, you had 400 milliliters of urine in your bladder, so I'm going to have to straight cath you. Straight catheterization is a procedure where I use a catheter to go directly into your urethra, through your urethra into your bladder, and remove the urine directly. It's a sterile technique, so I have to do it a particular way so that I can make sure you don't get an infection. So the first thing I'm going to do is I'm going to help you get into a position. I'm going to tilt your head back a little bit and put your legs up like a frog. Bend your knees and spread your legs a little. And then I'm going to use my warm wipe to clean your peri area. Using different sides. Discard it. I'm going to remove these gloves because they're no longer clean. And I'm going to wash my hands again. And now I'm going to open the catheter kit, the straight cath kit. Opening the one furthest from me out first, so this stays clean, sterile, I mean. That there. Okay, now I have to place this drape under your buttocks to keep everything clean. Okay, wash my hands. I have my sterile gloves. This kit didn't come with sterile gloves, so I had to use a different pair of gloves, but for the sake of the argument, this is sterile gloves. Alright, so I'm going to use my non-dominant hand first. So I gotta open this first. Okay. I'm gonna put the left side on first. I'm gonna grab it with my right hand. No. I'm gonna put the dominant hand on first. Grab it by the cuff. Leave the cuff on. And then grab this one by the cuff. Alrighty, that's done. This kit also did not come with lubrication, so I'm going to just verbalize that I'm going to pour the lubrication into the container, which I put in between the patient's thighs, and I lubricated up to 2 inches. 2 inches, yes. Okay. Now I'm going to cleanse the patient's peri area with the cleansing wipes. I'm going to start from the furthest. Using my non-dominant hand, I'm going to spread the labia, and I'm going to go down. The next one, closest to me, and then the last in the middle, down. Not removing my hand, I'm going to take my lubricated catheter and go right into the urethra. Okay, there's urine return. Let's just advance a tiny bit more. Okay, and I hold it there until the bladder is empty. Okay, Miss Smith, I'm going to remove the catheter now. You're all emptied out. Okay. And I'm going to get my rag, my wipe. I'm going to clean her off. Get rid of my mess. All in the garbage. Remove my gloves. Clean my hands. Okay, Miss Smith, you are all set. Cover the patient up and document.